One of the most important thing is, although it is a very aggressive cancer and the fatality is very high, I think we should never tell the patient there's no hope. My personal experience was when my brother, he was an educated person, when he was given the news that I can't do anything further to you, he suffered from the very, very bad acute depression I ever encountered.
They said, well, your mother will die within a year, that's what will happen. And I said, well, she can have chemo and can't she do other things? And I just felt that they would not let us entertain any hope. And I think that that's the really sad thing for a pancreatic cancer patient, that it's very hard to live with no hope.
One of the difficulties globally is a nihilistic attitude of many clinicians towards patients with pancreatic cancer. And that's really contributing a lot to the overall mortality.
He just told me in a way that I wasn't quite happy about, just like a casual way, and that was it.
Often the process of diagnosis is really stressful for people. They're overwhelmed with emotion and information, and they often are so emotional it's very difficult to process that information. So it's important to try and be patient with people, to know that you need to repeat information. And I think the value of that is it sets the scene for later on communication. So you put the work in early on, and often people will communicate a lot more clearly and efficiently with you. But also, people don't ask for help. They think they like to be strong. They don't want to, appear weak or vulnerable, often in front of their doctors, and they associate struggling emotionally with a poor outcome from their cancer, and they're often looking for any hint from the doctor that that might be the case. So just normalising, look, these are extraordinary circumstances. I recommend most of my people to catch up with the counsellor at some stage. I think that that's helpful. That really gives permission for the person to be struggling a bit emotionally and says it's okay, it's a valuable part of looking after all of your needs and the whole of you.
Generally with pancreatic cancer, it's got a bit too far by the time it's found. But they could have told me, yes, you can beat it, it is possible. It's not necessarily a death sentence. I was 50 and being told I'd be dead within 6 months. And I just wasn't prepared for that.
Certainly the reputation of pancreatic cancer in the past has been terrible, and some of that has translated into the future and into the current day. For example, surgery for pancreatic cancer was always seen as a major procedure with a mortality rate of about 20 to 25%. That has changed substantially. Now in specialist centres the mortality rate is around about 3%, 4% at most, equivalent to what you see in colorectal surgery. Most patients, doctors, will not consider a colorectal operation as an overly dramatic one. However, when faced with the prospect of a Whipple pancreatectomy, most specialists still consider that as an extremely major procedure. Certainly it is a major procedure, however, we can do it a lot safer now, and that changes the balance. With adjuvant chemotherapy, in some cases chemoradiotherapy, we can offer a subgroup of patients a 25% chance of 5-year survival.
I must be one of the luckiest people to have got through this whole procedure. Having been diagnosed once and then 2 years later having had a recurrence and then having further surgery with radiation therapy and chemotherapy after the second surgery, and to have come out of all of that and resumed normal lifestyle.
Unfortunately, only 20% of patients are suitable for surgery. However, picking those patients is difficult. From evidence from the United States, even from our country here, that as many as half of patients that have very early stage pancreatic cancer, cancer that is suitable for surgery, even after you take out patients that are not fit for an operation, only half of them get even offered an operation, or even half of that's even discussed with the patient.
When I went and saw my surgeon on the Monday, he explained the Whipples. He said, we can try it. Because we both said to him, well, they've told us they can't do anything. The tumour's too big, you know, it's sort of gone too far, they can't do anything. And he says, You never say never.
So in essence, treating pancreatic cancer is trying to do the right thing for the right patient. Certainly we don't want to operate on everybody because we're not going to do all of them good. We want to balance up the detriment of surgery versus the potential benefits. Discuss that with the patient and come up with a personalised treatment plan for that patient, not only just as an individual surgeon but also as part of a multidisciplinary team.
Lots of friends I knew who were nurses and medical people said that we should have had palliative care involved with Mum much earlier because there were a lot of issues with getting medications right and things like that. But Mum always liked to do what her oncologist told her to do, and her oncologist said to her that she was nowhere near that stage. So there's this perception that palliative care can only help you when you're ready to die, and it's just not true.
Palliative care has an enormous amount to offer to improve people's quality of life and symptom control for as long as they have a diagnosis of a life-threatening illness. Palliative care does frighten people because of its traditional association with the dying phase of illness, but it's really important to get the message out there that palliative care equally is for people with any degree of symptom that needs addressing, or any degree of psychosocial or psychological or emotional dimension that needs to be addressed by those of us that are caring for them. And the earlier the referral comes to palliative care, the better it usually is for patients and their families. There's nothing worse for patients who have a diagnosis of something like this than to be told, as they unfortunately still often are, there's nothing more that we, meaning us in the hospital system, can do. And palliative care is completely coming in to say that's never the case, that will never be the case. There's always plenty that can be done, and if other treatments are finishing or not appropriate, that's where palliative care really comes into its own and makes the running with an illness like pancreatic cancer